My name is Robert Schwab. I'm the Chief Medical Officer at Texas Health Allen and the executive sponsor for the Schwartz Rounds program across the system. The Schwartz Rounds are a program for hospital staff that addresses the emotional impact of being a caregiver. I think wellness is important to everybody, no matter what your job is. Healthcare workers, I think it's a bit more important because of the emotional nature of what we do. Being sick, being injured is a really difficult thing for patients. And for the caregivers, part of what has to happen is you have to show compassion, you have to be empathetic to these patients, and in doing that, you share their emotions to some degree. There's science that shows that compassionate care produces better outcomes. So if we demonstrate compassion in the care we're providing, then patients will be more compliant, they'll trust us better, they'll emotionally be better, which contributes to healing. There's lots of evidence that Schwartz Rounds increases the compassion of caregivers. So we're producing better caregivers and better outcomes that way.
My name's David Mussetter. I'm the Director of Respiratory Therapy. I've worked here for over 40 years and I call this place home. I find that Schwartz Rounds helps us deal with many stressful situations such as really contagious diseases where you're afraid, you're scared, you need to know your other coworkers are sharing those feelings with you. We deal with life and death situations every day.
The main thing is that it's confidential. It's something in there for everyone.
My name is Poria. I'm one of the medicine residents here at Presby Dallas. I was one of the panelists in Schwartz Rounds, and I was just sharing my story. Listen, wasn't this really frustrating, the situation that I was in? And when I started to tell the story, I was tearing up, and that was really the first time that I realized that this really had an impact on me. And so they were able to tell me that the feelings that I had were reasonable and were okay, and they showed me how to deal with that, and so that was very helpful. So not only did I feel better immediately just by being able to talk about what happened and the feelings that I had, but also they were able to provide me with their experience and their advice on how to deal with that situation, and that was also very helpful.
My name is Micah Foster. I work for Texas Health in Dallas. I'm a physical therapist and I've been working here for 27 years. When I first started, we didn't have something like Schwartz Round to help us through processing of difficult times or difficult emotions. I can remember back when I had a patient, my first patient that passed away when I was working with him, and we didn't have anything like Schwartz to go through that with us. And it's been a blessing for having Schwartz Rounds to be able to gather together with a group of people that have gone through some of the same difficulties that I've gone through, or just to have people to walk that road together with.
There will not come a time when this is easily funded through a budget because it's very soft stuff that doesn't have any return that's tangible. And so we depend upon philanthropy for programs like this.